All right, case number 6. Stings in my knee. This was submitted by Esther Son, who's a Pediatric Emergency Medicine Fellow from Akron Children's Hospital. Danielle Paulin helped out. This is a 6-year-old female who presents to an ED in Haiti with numerous painful nodular lesions all over her body. They've been there for 3 years, and she's got decreased function of her right shoulder and knee due to pain and swelling. She was evaluated when they first appeared, and they don't recall the name of the medicine she got with, but she did get better for a little while, but they came back. She's not had fever, chills, cough, abdominal pain, vomiting, diarrhea, or headaches. She's up to date on her vaccinations, including the BCG, and no one else in the family has a similar condition. On exam, she has multiple coarse subcutaneous lesions that are nodular on her extremities, abdomen, and the axillary lesion and buttocks. Some of them look scarred, others are pustular. She's got a deformity of her right shoulder and her right knee with swelling, warmth, and tenderness, but active and passive range of motion were intact. She also has axillary and inguinal lymphadenopathy. They got some labs. She has mild anemia with a hemoglobin and hematocrit of 9.7 and 30.5. Her electrolytes, including calcium and phosphate, are normal. Her PPD was non-reactive. Her ESR is 55. Her CK is 66. LDH 136. ANA and RF were negative, and then they sent lots of other antibodies, and those were all negative as well, like antihistone, dsDNA, Smith, Gonzalez, all of them. They were all negative. This is what the lesions and the rash look like. You can see her legs from 2 different angles. Here's a view of her abdomen and both legs as well. And because these lesions were uncomfortable and you could feel them, and they were distributed widely, the team was able to get some x-rays. And here's those dramatic films. Her femurs and her arm and chest. Here's 2 additional lower extremity x-rays. All right, so what's the diagnosis? Is this A, juvenile dermatomyositis, B, systemic sclerosis, C, systemic lupus erythematosus, D, dracunculiasis, or E, calcinosis cutis? Correct answer is E, calcinosis cutis. This is characterized by the deposition of insoluble calcium salts in the cutaneous and subcutaneous tissues. It presents with firm papules, nodules, or plaques, in addition to ulcerations with white or chalky discharge. Sometimes you can only see them on plain radiographs. Definitive diagnosis is made by skin biopsy. Treatments include calcium channel blockers, colchicine, minocycline, bisphosphonates, and corticosteroid injections. These can take a long time, up to years, to see full effect. Corticosteroid injections and laser therapy have also been utilized. The most effective treatment with the lowest recurrence risk is surgical excision. So this patient had a biopsy which confirmed the diagnosis. Her previous medication turned out to be a corticosteroid, and she was started on another taper. They're making plans to obtain colchicine from a regional hospital. All right. The one of these that I hadn't heard of was dracunculiasis, which sounds like a vampire disease, but it's actually the guinea worm, and fortunately, we're actually on the verge of eradicating it. It presents after drinking water contaminated with water fleas infected with the larvae. At first, you get painful blisters, and then mature worms will emerge 10 to 14 months later, usually isolated to the lower limbs. It's rarely fatal, but an infected person can become non-functional for weeks. Gross image warning. There's the little guy.